Assalamualaikum. Today I'll be discussing internal capsule with you. Now, what is this internal capsule? Internal capsule is just a large number of nerve fibers which project from the cerebral cortex and interconnect with the subcortical centers of brain and spinal cord. This is your internal capsule. This is your internal capsule. Fine. 1 minute. This is your internal capsule. Internal capsule, it is a bundle of nerve fibers that project from the cerebral cortex and interconnect with the subcortical centers. Then जो ये internal capsule होता है ना, superiorly it fan out as, I don't think that picture is here. Superiorly, your internal capsule, it fan out as corona radiata, but inferiorly it becomes more compact and forms the crus cerebri of the your midbrain. So these fibers, these nerve fibers, this internal capsule, superiorly it forms the corona radiata. You have seen in the previous pictures what corona radiata looks like. It is a fan shaped fiber of bundles. It is fan shaped fibers, corona radiata. The superiorly your internal capsule forms the corona radiata, and inferiorly it forms the compact crus cerebri of the midbrain. That also you know. Then, as you can see, this is your internal capsule. This is the anterior limb, this is the genu, and this is the posterior limb. This is the anterior limb, this is the genu, and this is the posterior limb. Anterior limb, this anterior limb, as you can see, it is separates your caudate nucleus from the anterior part of the lentiform. It separates your caudate nucleus from the anterior part of the lentiform. Caudate nucleus will be present medially and the lentiform will be present laterally. Then you have the posterior limb. This is your posterior limb. This posterior limb separates your thalamus from the posterior part of your lentiform. Posterior limb of the internal capsule separates the thalamus from the posterior part of the lentiform. Thalamus will be present medially and the posterior part of the lentiform will be present laterally. Then in between the two limbs, anterior limb and the posterior limb, you have a bend. This bend here is called as the genu. It is called as the genu. Here you can see the anterior and the posterior limb forms an angle. This bend is called as the genu. This bend is called as the genu. Then after that comes your another diagram. First of all, I want to tell you that your internal capsule has five parts. It has the anterior limb, it has the genu, it has the posterior limb. But there are two more parts, that is the retrolentiform part and the sublentiform part. It has the retrolentiform part and the sublentiform part. This is your lentiform nucleus. The part behind the lentiform nucleus, the part behind this lentiform nucleus, it is called as the retrolentiform part. The part beneath this lentiform nucleus, it is called as the sublentiform part. Your internal capsule has five parts. It has the anterior limb, it has the genu, it has the posterior limb, it has the retrolentiform part that is behind the lentiform nucleus, it has the sublentiform part that is beneath the lentiform nuclei. Then any fiber which passes via this group, it takes the most direct path to its destination. For example, अगर हमें कोई fiber आ रहा है from the anterior part of the frontal lobe, ठीक है, from the anterior part of the frontal lobe, it will pass through the anterior limb of the internal capsule. ठीक है, यहाँ पे होगा ना anterior limb आगे से, so fibers to and from the frontal lobe will pass through the anterior limb of the internal capsule, since it takes the most direct path, to its destination. Then your You have the ascending fibers in the internal capsule, and you have the descending fibers. Your internal capsule is what? It is a compact bundle of the nerve fibers, so it will contain the ascending as well as the descending fibers. If we talk about the ascending fibers also called as corticopetal fibers, see here, you have the anterior thalamic radiations, you have the superior thalamic radiations, you have the posterior thalamic radiation, and you have the inferior thalamic radiation. These are the thalamocortical fibers. These are the thalamocortical fibers. That means the fibers go from the thalamus to the various parts of the cortex, like from the thalamus to the frontal lobe, from the thalamus to your this somatosensory area, from the thalamus to your occipital area, from the thalamus to your temporal area. If we talk about the anterior thalamic radiation, these are your anterior thalamic radiations. Fibers to the frontal lobe, this is your frontal lobe. From the thalamus, the fibers from the thalamus to the frontal lobe comprise your anterior thalamic radiations. Then, as I have told you that the fibers take the most direct part, so they will pass through the, यहाँ पे क्या होगा, you will be having the anterior limb of the internal capsule here. You will be having the anterior limb of the internal capsule here. So here, see, these are your anterior thalamic radiation. These anterior thalamic radiations, they will pass via the anterior limb of the internal capsule, and these fibers come from the medial and anterior nuclei of thalamus. These fibers come from the medial and anterior nuclei of the thalamus. Fine. Some of the fibers of these radiations come from hypothalamus also. Some of these fibers come from hypothalamus, not only thalamus but from the hypothalamus also. That is another structure present beneath the thalamus. These were the anterior thalamic radiations. Then you have the superior thalamic radiations. Fibers traveling from the ventral group of the thalamus. यहाँ पे था medial और anterior group of thalamus जाता है frontal lobe की तरफ. Here you have the fibers traveling from the ventral group of nuclei. They go to the somatomotor, this is your somatomotor and somatosensory area. They go to the somatomotor and the somatosensory area, forming your superior thalamic radiation. And it is a common sense, they must be passing through the genu and the posterior limb. They must be passing through the genu and the posterior limb. See in the pic, they pass through the genu and the posterior limb. They pass through the genu and the posterior limb. They pass through the genu and the posterior limb. They pass through the genu and the posterior limb. After that comes your another class of fibers, ascending fibers, that is your posterior thalamic radiation. This pass from the fibers pass from the thalamus to the occipital lobe. Fibers pass to the thalamus, from the thalamus to the occipital lobe, and they constitute your posterior thalamic radiations. इसमें क्या होगा? If you have common sense, यहाँ पे you will be having your optic radiations. Fine. यहाँ पे आपका क्या occipital area में you have your visual area. So these will be the optic radiations. They will be from the lateral geniculate body to the visual cortex. Fine. They will be in the retrolentiform part of this. They will be in the retrolentiform. Retro means behind the lentiform nucleus. Here, posterior thalamic radiation. They will be present in the retrolentiform part of the internal capsules. Fine. They will be present in the internal posterior part of the internal capsule. Posterior part of the internal capsule. Then I'll again repeat the posterior thalamic radiations. Posterior thalamic radiations, as I have told you, they connect the thalamus to the occipital pole, and these include the optic radiations from the lateral geniculate body to the visual cortex. These radiations lie in the retrolentiform part and also contain some fibers passing from thalamus to the posterior part of the parietal lobe. Then you have the inferior thalamic radiation. These fibers come from the thalamus to the temporal lobe. These fibers come from the thalamus to the temporal lobe. And as you know, in your temporal lobe you have your auditory radiations. They include the auditory radiations from the medial geniculate body to the auditory area. These fibers pass through sublentiform. Sublentiform means below the lentiform, जो internal capsule का part होता है. They pass through the sublentiform part of the internal capsule. Again, I will repeat. You have the anterior thalamic radiations. Fibers go from the thalamus, medial and the anterior nuclei, and go to the frontal lobe. These form your anterior thalamic radiations. Then the superior thalamic radiations, they come from the ventral group of the nuclei of the thalamus and go to the somatomotor and the somatosensory area. Then you have the posterior thalamic radiations. They go from the thalamus to the occipital area, and this anterior thalamic radiation passes through the anterior limb. Superior passes through the genu and the posterior limb, and the posterior passes through the retrolentiform, which is behind the lentiform, and this is your retrolentiform part of the this internal capsule. Then the inferior thalamic radiations, they form your auditory radiation. Posterior form your optic radiation. So this was about the ascending fibers. Then comes your descending fibers or corticofugal. Ascending are called as the corticopedal, they are called as the corticofugal. Then the main group here is your corticopontine. That includes your frontopontine. See, that includes your frontopontine. Corticopontine includes your frontopontine and perithopontine, temporopontine and occipitopontine here. Corticopontine includes your frontopontine, perithopontine, temporopontine and occipitopontine nuclei. Corticopontine includes your frontopontine, perithopontine, temporopontine and occipitopontine fibers. They originate from all the four lobes of the cerebral cortex and go to the pons. जो अब ये frontopontine होता है ना, it comprises 55 to 60% of the corticopontine fibers. Therefore, as you can see in the picture, they pass through the anterior limb. Fine. They pass through the genu and the posterior limb. They pass through the anterior limb, genu and the posterior limb. Anterior limb, genu and the posterior limb. Which fibers? That is your frontopontine fibers, since they comprise the 55 to 60% of the corticopontine fibers. Fine. उसके बाद आते हैं आपके perithopontine, temporopontine and occipitopontine fibers. These fibers, talking about the perithopontine, it passes through the retrolentiform. Lentiform के पीछे वाले part, lentiform के पीछे वाले part से ये fibers pass हो जाते हैं. And in even sublentiform part, the part beneath the lentiform nucleus, वहाँ से भी pass होते हैं. Your temporopontine passes through the sublentiform part. Occipitopontine passes through the retrolentiform. Itself the word implies occipito means behind and temporo means beneath, so you can make it किस part से क्या pass होता है. ठीक है, it is not that difficult that you will not understand it. Then in the descending fibers you have the pyramidal and the extrapyramidal fibers also. Pyramidal fibers में आपका आता है corticonuclear and corticospinal. Corticonuclear fiber, they are for the motor nerve nuclei. ठीक है, they pass through the genu. ये bend है ना यहाँ पे, ये genu के through pass होते हैं. Then you have the corticospinal fibers. These are scattered bundle of fibers, and they pass in the posterior limb of the capsule. They pass in the posterior limb of the capsule. Then similarly you have the corticothalamic fibers. Corticothalamic fibers, they pass through the your corticothalamic fibers, they go from the cerebral cortex to the thalamus. They go from the cerebral cortex to the thalamus. After that comes your extrapyramidal fibers. Your extrapyramidal fibers, they include your corticostriate, that is from the cortex to the caudate and the lentiform, then corticorubeolar, from the cortex to the red nucleus, and then the corticoreticular, from the cortex to the reticular formation. For the arterial supply of the internal capsule, as you can see in the picture, anterior limb, upper part of the anterior limb, upper part of the genu, and upper part of the posterior limb are separated supplied by the medial and the lateral striate branches of middle cerebral artery, medial and the lateral striate branches of the middle cerebral artery. Then for the it is one of the जो lateral striate artery होती है ना, उसका एक branch most frequently बड़ा होता है, उसको हम बोलते हैं Charcot's artery of cerebral hemorrhage. It is called as the Charcot's artery of cerebral hemorrhage. Then you have the lower part. ये हो गया upper part of the anterior genu and the posterior limb. It is supplied by the medial and lateral striate branches of the middle cerebral arteries. Lower part of the anterior limb, it is supplied by the recurrent branch of anterior cerebral artery. Middle part by the branches from the internal carotid and the posterior communicating artery. Then the lower part of the posterior limb by the anterior choroidal artery. Retrorentiform and the subrentiform part also by the anterior choroidal artery. This was of the blood supply. Now if there is any occlusion or by thrombus or embolus, what will happen? The contralateral hemiplegia will occur if there is involvement of the retrolentiform part of the, that means जो occipital part की तरफ जाता है, अगर उस part को occlusion हो जाएगा तो there will be homonymous hemianopia, आँख को problem हो जाएगी. Then since it is a compact bundle of fibers, यहाँ पे थोड़ा सा damage भी अगर होगा, but effects will be large, क्योंकि bundles are these nerve fibers are tightly bound to each other. Fine. Then you can have faciobrachial monoplegia also, that you will see in the book what it is. Thank you.